let me begin by saying I'm so happy again to be joined by Reverend Stephanie Duzant, all the way out in Nevada, 2 different time zones. It's so nice that we can get together by Zoom. That's one of the advantages of this COVID time, is the way in which people are getting together. I have to say that we stopped doing like the regular Zoom that we were doing at church. And I tried doing like this hybrid thing. And then I realized that we weren't interacting on Zoom the way we were before, you know, because a lot of churches, they do that. They just live stream what's happening and you just sit there and watch. But when we were doing the Zoom, we were really engaging with each other.
Right.
And it was like, you know, we were seeing people's pets and hearing people's babies cry, and people were showing us their Christmas trees. It was like we were visiting each other in our home.
Exactly.
I've actually gotten back to that, to say, let's do the Zoom and then let's do a live service. Everyone has their masks and everything.
Right.
But trying to do those two together was just like, I wasn't really concentrating on the people in Zoom, and sometimes the sound wasn't working and they couldn't hear. And
yeah,
Zoom has enabled, you know, people like you and I to keep in touch.
Right. I'm still on the ministerial staff of my church in New York because of Zoom.
Yeah. So my idea was to talk about a lot of the controversy that's going on now. Abortion has been a big issue in American politics. And it's become a big issue recently because of what's happening in Texas.
Yes.
And I think a
and
lot
what might happen in Mississippi.
Yeah.
Yeah.
I mean, Texas could be just the start, sure, yeah, because the Supreme Court ruled on it, and that means that other states are going to follow.
Right.
But I do want to talk about, you know, kind of how our faith informs our view of this. So that is personal, right? It's, you know, about my faith understanding.
I'm sure we have ministry experiences.
Yes.
But, you know, and I know I'm a social worker, so I've done pastoral care.
Yeah.
But we minister to people who have had abortions, who contemplate it.
Yeah.
And not just because they're trying to get rid of, you know, an unwanted pregnancy,
yeah.
you know.
Yeah. Women pastors encounter that a lot more than male pastors do.
Right.
Yeah.
Right.
So I guess I was thinking of two parts. The first part was, you know, kind of how your understanding has evolved, because my understanding has evolved a lot. And then maybe to talk a little bit about, you know, as a church, how we kind of understand this and how we kind of talk about it. So the first part, if I could just say that, you know, I went to 16 years of Catholic school. So, you know, after 16 years of Catholic school, you're pretty convinced that abortion is wrong, and that, you know, everybody you know should agree with you on that. And that it's the most important thing when you go into the voting booth. So in college, you know, I was pretty convinced, starting out college, that abortion was a litmus test for politicians. So I think I probably became more politically involved than a lot of people. I majored in political science and became, you know, started working in state government. And also I was involved with Christian groups like Pax Christi, which is a Catholic peace and justice group. And so I began to realize that I was concerned about a lot of issues. And there were some people who were only concerned about abortion. And, you know, that the tension with that, you know, got more and more strained, because I realized that I cared about war, and I cared about capital punishment, and I cared about racism, and I cared about poverty, and I cared about the environment. And the people who said we have to be pro-life on abortion didn't care about poverty. You know, they thought everything's fine with poverty, you know, go down to the soup kitchen and help out. They didn't care about racism. They was like, you know, okay, just be nice to your neighbor. They didn't care about war. They're like, you know, we have to protect ourselves. So I began to realize, you know, they're talking so much about life. And there was a very thin sliver that said, I'm against abortion, and I'm against capital punishment, and I'm against war. And so many of them were against abortion, but they were very pro-war, you know, and they were very complacent with the situation of poverty in this world. So I think my education and going to church every Sunday and having my parents reinforce that, because they were both very active in church, had me going in one direction. But as I started to encounter more people and to, you know, really make that a strong part of my life, I was like, you know, something doesn't go together here, that these people are not concerned about women's rights. They're not concerned about poverty. They're not concerned about war. So that I realized that all the, the people I wanted to vote for, they all lined up, on one side about abortion, but on everything else, they were on a different side from where I wanted to be.
Right.
Do you feel like, feel like your upbringing gave you a view, or?
Yeah. I didn't really realize how conservative my family's theology was. Until probably when I got to college. I come from, my father was a Catholic. My grandmother was a Jehovah's Witness. My mother was a Moravian turned AME. And so I had a lot of influences. My aunt is a Seventh-day Adventist. So I had a lot of influence, but the influences was very conservative when it came to abortion. But it became conflicting because we're African American, we're immigrant descendant, and some immigrants, right? My grandmother was an immigrant. And so we were on the side of the poor, of, the war was a little iffy because a lot of people from our community went to the military. Yeah. That was a way out, right? Yeah. And so the war was iffy because I come from a military family. But we didn't want people going to war unnecessarily. We were against poverty. We were, fighting against poverty, fighting for civil rights. And so many of the politicians from our community were pro-choice, right? And we were also looking at what was going on in our own communities, right? Young girls having babies, teen pregnancy, issues with children being born addicted to crack, mother hell house. So could we be totally anti-abortion when the community was so full of other issues? But theologically, we was like, we're against abortion, but we understand why people do it. And it's funny, when I got into graduate school, the first major paper I wrote for my policy class for social work policy was on abortion. And as I did the research for the paper, you had to take a position. It was a position paper. And my professor wouldn't give me an A because I wouldn't take a position. He gave me like a B++. He's like, you gotta make a choice. And so, because my position was, I'm a social worker. And so I'm not gonna say yay or nay. It's a decision that my clients have to make. Now, and I felt that way at that time because of my theological conundrum, which way do I go? 20 years later, of course, I'm pro-choice. Yeah. And mainly because not of my social work, but because of the ministry I do. And the women and men I have encountered, and the choices that people have to make. And at the end of the day, I'm pro-choice, right? A lot of people think that means, oh, you're just against, you're just for abortion. Yeah. But no, I'm for the right for people to make a choice. Yeah. You can't take away people's ability to make a choice for their own life. And you can't make people feel bad about the choices that they make. I do remember counseling a family who had to make that decision, and it was based upon health reasons. Yeah. And so some people would tell her, oh, you just got to trust God. you know, you be okay. But the doctors made it very clear to her. She had had 3 pregnancies, and the last pregnancy was very bad for her. And the doctors made it clear that there's a great chance that you will not survive this pregnancy.
Wow. Yeah.
And so, you know, she's thinking about her 3 children that are here. You know, she's thinking about her husband, the life they have. And I commend the husband because he left it up to her. And so people don't take those stories into consideration, I feel.
Yeah. Yeah.
I feel people are not thinking about, it's not just about somebody having a sexual experience and they just end up with an unwanted pregnancy. There's so many more dynamics to this.
Yeah. Yeah.
And you can't take away people's choice. I know young girls that I went to school with who were forced to have babies that were results of rape and incest. You know, and what does that do to the person, to the woman? What does that do to the child? They're not taking into consideration those perspectives. And some children come out good.
Yeah.
But what does it do for the mother? What does it do? You know. Yeah. And why are we pushing this theological thought that God's gonna punish you if you abort a child that was made in rape? God's gonna punish you for not having your father or your uncle or your brother's child. Why are we doing that? You know,
I think a lot of people, their opinion is based on, you know, just they have an opinion and they haven't tested it in real life. They haven't been in a position of responsibility, you know, to make a law or a policy or to counsel people from a position of, you know, a social worker or a pastor.
Exactly.
So the first time I voted, I was still kind of in the pro-life camp as, you know, a teenager voting for the first time. And so I said, well, I'm going to vote for the right to life candidate. And I did that because they were running against somebody who was definitely going to be reelected. And I was like, well, you know, let me just vote for the pro-life person. They're not going to win, and I'm making a statement or something like that. So that was voting for New York governor. So I voted for the pro-life candidate against Mayor Cuomo. I was like, Mayor Cuomo is definitely going to win. You know, I'm just going to, you know, make a statement here.
Right.
4 years later, I was working for Mayor Cuomo. So, you know, I think I went through a big evolution there, and then I continued to evolve on a lot of issues over that time. But when you don't get into that position of having to think about how does this actually play out for people in their lives, it's easy just to make a decision. Right. So I feel like there's like these polar opposites, you know, that there's widely divergent views, and then there's a lot of people who kind of fall somewhere in the middle. And one of the very far positions is the Catholic Church that I was growing up in, which was you can't have an abortion, you can't use birth control. You know, so to have those two things together is like, well, if you don't let people use birth control, you know, what do you expect to happen with unintended pregnancies or unwanted pregnancies? So the contradiction there was just really crazy. So I think for a lot of people, it comes down to they don't want people having sex.
Right. And that's ridiculous.
They'd be punished if they've had sex. And
that's ridiculous. I mean, and why I say it's ridiculous, because sex is a part of our human development, our human behavior. And not only that, and this is what we need to talk about, especially in the church, sex is good for your health. Recently, somebody said to me that their PSA numbers went up, and the doctor asked them if they were having sex, because that helps with keeping your PSA numbers down. And so the human urge, right, to have sex is biological, is a part of our makeup. It's not because you're deviant. It's not because you're lustful. It's because it's your body craves for what it needs.
My parents are good Roman Catholics, so they had 8 kids. And my mother admitted to me one time that she would have been happy with 5 kids. And I was kid number 8.
Wow.
She's telling me this, and I'm like, kid number 8. I don't think I even confronted that at the time to wonder why she was saying that. But I asked my dad one time, and he said that they went to rhythm method classes. So you had to figure out, you know, your ovulation and take your temperature, whatever, so that you would know when it was safe, that you wouldn't get pregnant. You know, and they had another 4 kids with trying to use the rhythm method.
Right, because again, we don't educate ourselves, right? A woman's body and cycle changes as they age, changes with the environment, changes as they are in community with other women.
And who wants to schedule their intimate life?
Right.
So to think about it, you know, a priest standing in the pulpit is telling people when they can have sex. You know, you have to be married, and, you know, you have to be willing to, you know, conceive, or you have to do it this time or that time.
Right.
They were telling people who they could have sex with in terms of what gender you could have sex with.
Right.
You know, the idea of how much they were trying to regulate people's sex lives, who you could have sex with, when you could have sex.
How you can have sex.
I'm sorry?
I said how you can have sex.
How you can have sex, yeah. Who and how you have to do that. And then to think, you know, that so many of these people were predators, you know, they were pedophiles or they were predators.
Exactly.
That they thought that it was okay for them to break the most basic ideas about intimacy.
Right.
But to tell everybody else that they had to, you know, have all of these extra layers of regulation on what they could do. You know, just realizing that level of hypocrisy, then it just kind of blows the whole thing apart. So I think with abortion, some people it's about, you know, these people are having sex and they should be punished for it. They should get pregnant, they should get an STD because they shouldn't have had sex in the first place. And then when the AIDS epidemic came along, people were saying, well, you got AIDS because you're gay. So that again, they thought if you're going to do sex in a way that we don't approve of, you should die for it.
Right.
You should be stuck with a child that you can't afford to take care of, or you should be stuck with a pregnancy that is not safe for you because you went and you had sex and you shouldn't have done that. So, you know, with AIDS, you really see that, you know, that they wanted people to die because of their sexual orientation and living out their sexual orientation.
Right. But then you had women who were married, who were contracting AIDS from their partners.
Yeah.
And they weren't living a sinful life.
Yeah.
You know, and so then that's when it became clear that AIDS wasn't just a gay disease, right?
Yeah.
And that people who you think are living one life are living a whole different life. You know, when the children, I had many clients on my caseload with children who were born from parents who were drug users and contracted AIDS, right? And then the children have AIDS.
Yeah.
And so are we condemning these children? You know, what are we telling these children?
And just the idea of a God who punishes people, you know, I mean,
right.
Jesus was punished and Jesus didn't deserve to be punished. And that's supposed to be an example for us of how God is caring for people who are punished.
Exactly.
To the point of solidarity, of radical solidarity.
Exactly. And then what's ironic to me is that the right, when it's in their favor, pushes this whole notion of forgiveness. You know, we're supposed to forgive when they do something wrong, but you know, when they're pedophiles, like when they're caught with their hand in the cookie jar, whatever, and then, but you don't want to give that same level of forgiveness to anybody else. It's ridiculous.
It's not consistent.
Yeah.
Let me just share now. We have a resource in the ELCA. Close this. Close this. I had to set, but I don't. Here we are. So in the ELCA, we have this resource where we make social statements.
Right.
Social statements are commissioned. A national assembly, which we call our churchwide assembly, says we need a statement on this. And because that is commissioned, then a task force is put together, and then there are hearings and there are drafts. So this is the social statement that was made on abortion, which was one of the earliest ones that the ELCA made, the ELCA being, 45 years old. So this is 1991, which is a good while ago now. So there's a summary here. So I think what this tries to do is it tries to avoid some of the extreme opposite positions. So it says, they want to affirm and support life. They want to reduce the number of unintended pregnancies. I kind of remember Hillary Clinton saying this in the 90s when she was running for US Senate, saying that she wasn't going to oppose abortion, but she was going to kind of reach out to people who were against abortion by saying, I'm going to do everything I can to reduce the number of unintended pregnancies. So this is kind of another one of those ideas. So the statement reminds the church to be compassionate. The church encourages women with unintended pregnancies to continue pregnancy. So it's trying to take this idea that abortion is a last resort, that they don't want it necessarily to be harshly regulated. But while we don't want the government regulating it, that maybe from a church point of view, we want to help people to avoid abortion. So this is kind of a summary. Regulation of abortion is where members of the church disagree widely. So we have to, we come from these conservative traditions or in a liberal tradition. Whatever congregation we're in, we're going to have people on opposite sides of this issue.
Right.
So they make a statement that says, because of our conviction that both the life of the woman and the life of the womb must be respected by law, the church opposes a lack of regulation on abortion. So can there be some regulation on abortion? It shouldn't be interfering with women's rights, but can there be some regulation? The church is opposed to legislation that would outlaw abortion in all circumstances. The church opposes laws that prevent access to information about all options available to women. We know that internationally, the United States won't fund efforts to tell women about their alternatives.
Right.
The church opposes mandatory or coerced abortion or sterilization, which is the other side of this, is that there have been women who have, been forced to be sterilized and forced to have abortions. So it's not about whether or not to have an abortion as to who gets to decide it, because the decision goes both ways in people deciding for women. The church is opposed to laws that prevent couples from practicing contraception. There are still companies that don't want to allow health insurance to cover contraceptions for people. The church opposes laws that are primarily intended to harass those contemplating or deciding for an abortion. And I think that's where Texas comes in, is that they just want these vigilantes going on and on, interfering with people's ability to do what they want.
Can you imagine you pay somebody to report that somebody's having an abortion?
Yeah.
That's ridiculous.
Yeah.
And a waste of money.
Yeah. And there's always been this radical element that was bombing clinics and harassing doctors. There's nothing more difficult in the medical profession than trying to run a clinic where people can go and get reproductive services, because sometimes you're taking your own life into your hand, that some radical is going to show up and try to hurt you.
Right.
Or that people are going to be protesting outside and nobody feels safe crossing that line of protesters.
Right.
So I'm wondering, this is quite old now, 1991, in terms of all the things that have happened politically. I mean, this is before marriage equality, and look at all the advances we've made in social circumstances. I think women's rights. I think it's been very uneven and it's very much back and forth or whatever. But so the idea that the church opposes a lack of regulation. So the church is in favor of some regulation. I'm wondering if that's outdated, or is that still a good concept?
I'm a person that really believes in the separation of church and state. And I think that the church's position should be to speak to issues in the community. But anything that infringes on anyone's ability to make personal choices for their lives, that don't harm community, that don't harm anybody else, you know, just a personal choice for their life, the church doesn't have a say on that. That's just my position on it. And the church shouldn't be trying to have a say on that. It's not, it's out, you know, even Jesus didn't do that. You know, even Jesus didn't do that. Jesus didn't heal anybody who didn't want to be healed, right? Many times when we read the Bible, do you want to be healed? Do you want to be well? You know, it was always a choice that you could make. And so when do we stop letting people make a choice? The church's response should be to whatever choice was made. Right? Not to you have to do this or you have to do that. That's not our position.
So the social statement tries to say, you know, that the church is not opposed to regulation. I guess because some people become such purists ideologically that, you know, they want this to be an absolute right. And so what Roe v. Wade is based on is the right to privacy, which is based on the 14th Amendment. So the Supreme Court did not say there's an absolute right. You know, it gives you differences by trimester and whatnot, saying that the state can regulate, you know, based on, you know, scientific evidence as to when's, you know, what's appropriate to different times. It kind of reminds me of when a lot of churches were debating gay marriage, you know. We had that debate, you know, 20 years ago now.
And AME Church was still having that debate.
Yeah. So on a policy level, we've settled it, even though it's still there's still differences. But back when that debate was going on, there were people who would say God doesn't care about what happens in the bedroom, and I would say I think God cares about what happens in the bedroom. You know, I think God doesn't want us to say, you know, you have to be different genders or whatever. But God doesn't want people to be coerced into sex. God doesn't want incest to be happening. God doesn't want people to be raped. Within marriage, without of marriage, there should be consent. It's a sacred act. To say that God doesn't care about that, as if to say, let's not talk about it, let's hide it, it's shameful. Don't get involved in it. Don't infringe on it. Leave it out of view, out of, you know, public sight or whatever. So this idea that, you know, we don't want there to be a lack of regulation. We think that government can regulate certain things that are important for the common good.
I think it has to be, any regulation has to be about harm, about danger, right? Just like you say with the sexuality piece, with the marriage or LGBT, nobody should be engaging without consent. Nobody should be engaging if they're underage. Nobody should, you know, those kind of regulations. To do no harm. But this whole notion of the fetus being a live entity, it always takes me back to the scripture. How can you believe in a God you don't see? How can you love a God you don't see, but you don't love your fellow, you know, brother, sister who you do see? And so, of course, you know, my own personal stance is that it is life, right? But you so concerned about a fetus, and you're not concerned about the person who's carrying the fetus. You're not even concerned about what kind of world the fetus is going to come into. What's the circumstance around the fetus? You're not concerned about all the other children that were born who are in foster care, who are homeless, who, you know, who have physical and mental conditions that nobody is really caring about on a large scale. And so that if you're going to be pro-life, how far are you going to take this pro-life?
Those people are pro-birth.
Exactly. You're not pro-life, you're pro-birth. And that's a problem. And that's a problem.
There's also been a lot of histories that have been written that are quite interesting in terms of looking back at the 1970s and seeing that, you know, in the 60s and 70s, people were running for office on a segregation platform.
Right.
You had people running for president, you had people running for governor, you had people running for Senate as segregationists.
Right.
And then as the 70s started, they were like, well, we can't do that anymore. We can't be segregationists.
Right.
So they may have had 20 years of running as a segregationist, but now they couldn't anymore. And so there's been a couple of people who've made the case, and I find it compelling, that those people decided that they were pro-life and that they couldn't publicly, you know, march behind the Confederate flag, but they were going to march behind a pro-life
abortion flag.
Yeah.
Right. But how you know, when I read up on this, how evil is that?
Mm-hmm.
The mindset that we're going to develop a position that will draw people in, people who we want to be segregated from, people who we really don't care about, people who we know are using this same position to oppress people. And we're going to use this so that we can continue our own segregated and racist behaviors and living social dynamics. I mean, that's just evil.
And then when you see that the impact is different on poor women than on wealthy women, the impact is different on wealthy countries and on poor countries.
That's right.
That's kind of consistent with that.
I'm a fan of Call the Midwife, the PBS show. And I just watched an episode where in 1968, they're dealing with this issue of abortion. And so they send, the nuns are trying to develop funds to keep their program open. So a wealthy hospital wants to partner with them. And they send one of the nurses. And so the nurse goes and the head nun says, make sure there's no discrepancies, you know, before we partner with these people. And so, long story short, they find out that the wealthy hospital is secretly doing abortion, right? And so that these wealthy women can afford to get abortion.
Yeah, if you can pay for it.
If you can pay for it.
There was a program on NPR yesterday talking about Doctors Without Borders. So, you know, to kind of look at the other side, you know, the liberals, the people who are pro-choice or whatever, you know, people who care about the third world. So Doctors Without Borders, they were saying it's basically been a model of white European doctors going and helping people of color. And Doctors Without Borders, you know, most people think that, you know, what could be a better charity than Doctors Without Borders? And you can't say that they're not doing good work.
Right.
The way they treat the local people who they employ and the way they treat the international people that they employ, you know, there's a big discrepancy there. There's a lot of inequity there. And so Doctors Without Borders and lots of humanitarian organizations have had to be confronted with the idea that they have a European model of charity, you know, individuals giving money for individuals to voluntarily go, as opposed to, you know, some kind of reparations or something that would, you know, make the situation better overall. Right. Instead of saying we need to continue white charity to these countries. So that was something I hadn't heard before. It was kind of interesting.
Yeah. I mean, it's just like all the missionary trips to Haiti.
Yeah.
You know, it used to be advertised, you know, you could take a missionary vacation.
Yeah.
Imagine.
Yeah.
You know, and so instead of, how about I give the money, like you say, let's help to reconstruct Haiti, to build back its infrastructure. Yeah. But no, I'll use it and we'll go on these missionary vacations and help all the poor Haitians and feel good about ourselves. It's ridiculous.
On Sunday, I had to talk about, you know, the Haitians at the border and just those images that we had to see this past week.
Right.
Of cowboys, you know, government employees, cowboys on horses with ropes and with whips after people who, you know, these people are fleeing desperate poverty and violence. They've got a plastic bag in one hand and they've got a baby on their shoulder. And all we can think is that we need, you know, to scare these people away.
Right. But, and at a time when we're taking in Afghanistan refugees, and as we should, right?
Yeah.
But we don't look at the role that America played in the deconstruction of Haitian society to get to where it is, right? And so,
is it Paul Farmer has the book The Uses of Haiti, that gives a whole history of America's involvement in Haiti?
Right.
He comes from a medical point of view.
Well, but government part of view, will we own, you know, the middle of America if it wasn't for the Haitians helping America to fight against France, right?
Yeah.
Would that be possible? Mexico owes France, Haiti too. I want to say that. Yeah. Mexico owes Haiti too. And so we're not looking at the full historical view, right? We're not looking at the reparations that Haiti was forced to pay France and that America bullied them into paying, right? We're not looking at the occupation of America and Haiti. We're not looking at that in the early 20th century. We're not looking at that. And so I think bringing it back to the abortion issue, we're not looking at the historical purview of abortion in this country and what it did to the country when it was illegal, right? And in all classes, can I say that? Not just for the poor, but in all classes, that women were putting themselves in harm's way.
Yeah.
Not to have children. And you know, to look at it, what's the root of it, right? My family's from the Caribbean, and I do a lot of historical research. So one of my books, I found that in the early 20th century, in the United States Virgin Islands, it was illegal for women to drink a bush that would cause abortion, right? and so I was shocked to read that, because first of all, who told the law enforcement that the bush could do this?
Yeah.
Right. Yeah. and how do you know the women were drinking the bush, right? But that you make this act of drinking a natural tea, illegal, right? But when you look at the economic position that the island was in, even after America acquired it in 1917, it didn't get any better, really. Yeah. And so you're going to put a woman in jail because she decides that she can't afford to have a baby? Is that Lorna? Hi, Lorna.
Bringing me lunch? Oh, look at this. Thank you.
Hi, Stephanie.
How are you?
I'm good. How are you?
Good. I'm good.
I was just going to say that I was talking to a friend about The Handmaid's Tale, Atwood, and I think it's an example. Thank you. I think it's an example of science fiction that, you know, has a point, and that's even actually got historical references. So this friend of mine was saying, you know, The Handmaid's Tale, that's about the Taliban, because that's the way the Taliban treats people. You know, there's something about the Taliban won't allow people to get their beards trimmed today. And of course, girls are being harassed at schools and whatnot. And I don't know why that stuck in my head, but that stuck in my head for days. And then finally it came to me, it's about America. America has captured people and imprisoned people for their life.
That's right.
America has forcibly raped those people. In America, those people, you know, they've been separated from their families.
That's right.
So The Handmaid's Tale is science fiction in a sense, but it's also showing you exactly what's been happening for most of Americans' history. It's shocking because they're white women.
Right.
And you're thinking, oh my God, how could they do this to these women?
Right.
But the history is that we've done that throughout history.
We've done that. Right. Right. That we've done that. And people need to know. And I want to say too, this whole abortion, the anti-abortion, when I was a social worker in child welfare, my coworkers, you know, would be say, really? I said, I'm worried more for my white clients around this racist policies because their parents get away with harming them.
Mm-hmm.
Their parents get away with beating them and torturing them and then crying, and the children are in danger.
Yeah.
The children are in danger. And so we look at this
anti-abortion. The white privilege of the parents protects
the white privilege of the parents, exactly. The white privilege of the parents, and the children become in danger. Right? And so this anti-abortion law, I don't really think they really want to admit that they're putting their own community, women in their community, and maybe they don't care because they are looking for a more patriarchal society anyway. But just the other day, I was reading anonymous tales of women from the right who had to sneak and have abortions. And so they're not looking at, these abortions are not going to stop. In that paper I wrote 20 years ago, many of the stories were white women. These abortions are not going to stop. Making these laws is not going to make abortion go away, and it's going to affect the white privilege, I feel, even more so.
The other thing about the Handmaid's Tale is that, the role of religion in that whole story, to make people think that what's wrong is right.
Exactly.
And what's evil is good. To make people think that, for these women to be treated this way, to be submissive, is godly. That idea of that language being used to sanction slavery, to sanction colonialism, to sanction patriarchy.
Right.
It's something
that goes back to the church's poor interpretation, and not enough churches correcting that wrong.
Yeah.
Not enough churches really pushing a true exegesis of the text to show what Jesus was really about. I mean, Jesus wouldn't have a ministry if it wasn't for women. Jesus had so many women around him.
Yeah. I posted something this morning. Do the stories of the Bible condone bad behavior? The stories about war, the stories about slavery, the stories about polygamy. And let's see, I've got two responses here. The first one was, no, they instruct people how to elevate one's thought, to progress from action to do what is right and good. God is forgiving and loving God. God destroys the sin by elevating our thinking. So that's someone saying how they interpret those stories. It's not saying the stories, on their face.
Right.
Because I think people can open up those stories and use them to sanction war and slavery and patriarchal oppression.
I recently participated in a Zoom with Reverend Dr. Pamela Lightsey. She's from the Episcopal Church, but she's also academic out of Massachusetts. And so she was talking about, it was about how we read the Bible and intersectionality. But what stuck with me is no one comes to the Bible objectively. And so we bring ourselves, you have to know your social location, right? And so I teach students on the ordination track for the AME Church. And so the class I teach is reading the Bible through various theological lenses. And one of the assignments is for each student to socially locate themselves. Because you have to know what you're bringing to your reading of the Bible.
Yeah.
So if you're bringing yourself, and then you're bringing interpretations that you learned when you was a kid going to Sunday school and or even under the teachers that you're under now, right? How does those help other people? You have to really think about what you're hearing and what you're reading and how you're preaching that, right? And so as I teach this class, I've taught it for a few years now, And many of the students become shocked. Right? And even when I preach sometimes, or if I'm teaching, because are you reading the Bible from your own position? Are you reading the Bible from your pastor's position? Are you reading the Bible from your mother's position? Right? And are you willing to be objective? Even though you can't come to it objectively, but to intentionally say, well, let me step back and look at this from another point of view.
We're doing a series now. We're doing a series on Genesis now. And 2 weeks ago, the reading in the narrative lectionary was supposed to be the binding of Isaac. And I said, I'm not going to read this story. I can't adequately talk about the binding of Isaac in a worship service that's an hour long and make sure that everyone's understood what that story, that can't be a Sunday morning story. That could be for an advanced course to try to figure that out. So I skipped a couple of verses and I went to the story of Hagar and Ishmael. And I started, I showed this story to people and in the worship service, and I said, is the Bible told from the point of view of the slave owner or from the enslaved person?
That's right.
Because I think a lot of us in a European Christian tradition have thought that it was from the point of view of the slave owner.
Of course.
And when you're reading the story of Hagar, you're like, well, it's not just that point of view. We also have this point of view, which probably doesn't get read half as much as the binding of Isaac, which, traumatizes half of us. But so is the Bible told from the point of view of the slave owner or the enslaved person? I guess it's both in some sense, right? But you're trying to figure out where God's position is in that. So to place yourself and to realize how you've been placed.
Right. I always ask people, who are you in this story?
Yeah.
Who are you? Are you Hagar?
Yeah.
Are you Sarah? Are you Abraham?
Yeah.
Who are you in this story? And so, when you recognize, sometimes I am the Roman soldier. That really messed with me when I, when I realized that I'm the Roman soldier because I work for child welfare, right? And I have held laws that sometimes were oppressive, and so this is why the Gospel of Luke really helped me through, because there's room for everybody at the table, as long as you are righteous, right? But you have to admit who you are and then make your decision, right? You have to admit, and then you have to, I think also too, we have to say that the Bible can be problematic in some space. Judges 19. Ain't nothing good about that story. There's nothing good about Judges 19.
You're talking about the rape?
Huh?
Is that the one with the rape you're talking about?
What, right, with the concubine and the rape and I mean, reading that, the first time I heard it preached was the late Robina Wimbush. She preached it, and it opened my eyes so much. But also, then I became a social worker, and to read it from a perspective of domestic violence.
Yeah.
She runs away, goes to her father, and the father tries to delay that her leaving with her husband when the husband comes back to get her.
Yeah.
And the father tries to delay, and he tries to delay. But he can't delay any longer because the husband is now adamant, we gotta go.
Yeah.
And so they get to the town, and he, you gotta say, what kind of joker is this guy? He, somebody comes and tells him, listen, don't sleep outside. We're gonna sleep outside. And they're like, no, listen, no, really, let's not sleep outside. So he goes to the home with the person, and here comes the town people to rape him, right? To rape him. And the person who brings him in offers up his daughters.
Yeah.
What kind of person are you? Okay. And so the people refuse. So they push the concubine out. They push her out, and she's raped to death. Right? And he kicks her body, get up. She doesn't get up. He puts her body on the horse, and they go home. And he cuts her body into 12 pieces because he's been offended. because he's been offended. What good is in that story? Right? And then it took Reverend Dr. Gina Stewart to preach. I heard her preach, and she said, there's no God is not in this story. And I was like, whoo. God is not in this story. Notice that there's no mention of God in this story. Sometimes the Bible is problematic.
So we have to place ourselves, and then we also have to realize that we can place other people too. You know, this is my position, but then there are other valid positions.
Right.
And it shouldn't just be about my position in the story. It should be about all the positions in the story.
All the positions in the story.
So Reverend Stephanie, I want to thank you so much for this time. I don't want to take too much of your time. And I'm sure you've got a lot of good work that you have to do today.
Yeah.
So I'm glad that things are a little bit better, and I hope that things continue to get better.
Yeah. Thank you.
By God's grace, we're going to be living in a world where we can get together more easily.
That's our prayer.
Yeah.
That's our prayer. But I'm, glad to see you, and I'm keeping you in the church and the daycare in my prayers. Especially what happened with Hurricane Ida. I felt for my New York family.
We got water downstairs, and it just took days to clean the place up. But people, this area, Rybrook and Rye and Harrison, there were people who just lost entire businesses. There were people who lost entire apartments. People were just wiped out. Who weren't wiped out by Sandy or any of those other coastal hurricanes, but this coming down out of the sky, it just hit people who'd never been hit by a hurricane before.
Yeah.
So
the loss of life in my old community was so tragic,
Yeah. New Jersey and places where you live in basement apartments. That was you couldn't get out fast enough.
Couldn't get out fast enough. The power of water, the power of rain, the power of nature.
Yeah.
So I'm praying that in all of these things that we recognize that global warming is real, that we have to do something about environmental health.
Yeah.
We got to tackle these, instead of trying to control people, let's come together and for the good of the world.
Yeah, for the sake of the world.
Yeah.
Thank you so much, Reverend Stephanie.
Thank you. Thank you, Pastor.
God bless you and your family.
Thank you. Same to you. God bless you all. Enjoy your lunch.
Thank you.
Okay.
Bye-bye.
Bye-bye.